Hi, everyone. I'm Anthony Gauthier for Your Journey to Medicine, and I'm really excited to share this interview with you. Sandra Wong, she's a current nursing student, but she has an amazing story of what brought her to where she is today. She's been involved in a lot of different things. She's done modeling, been a social media influencer, as well as pursued MD, PA, until finally landing into nursing. She gives wonderful advice and insight on anyone out there that may not be 100% certain on what career path to take. You want to learn from her because she's gone through it all. And I'm so excited she was able to share this advice with all of you. So without further ado, sit back and enjoy. Thank you so much, Sandra, for joining me today. I'm really excited to share your story with all the listeners out there. And you have just such a motivational story. I really wanted to share, and you're doing so many amazing things for the community. There's things like the MedCon and things with your personal brand. And you have a unique story, and I really want to share it, but we got to start at the beginning. So maybe just kind of briefly tell everyone a little bit about your background growing up. Were you interested in medicine early on in your life, or did it take till you're a little bit older? Maybe share some of those things with people.
Yeah, I mean, growing up, I'm a first generation student. My family originated from Burma, so I just had this need to help the community. So we always went to like temples on the weekend where I would be like helping out with like preparing the food to give, to the people in the community. And I just had this like strong need to give back in like whatever way possible. And just like growing up, going into college, and now I feel like I have that urge even more because I know that with my background with like being a spokesmodel and like what I know about events, I wanted to bring that into medicine. And I feel like by creating MedCon, I'm able to help the community by inspiring those who are looking to get into healthcare.
Awesome. And we'll talk more about MedCon later on because I know
Yeah.
it's a really awesome event that you had in the past, and I was thankful to be a part of it and look forward to it in the future and it growing and everything. But kind of when you were doing the things and helping out and volunteering, was that like your early teenage years, or was it something that your parents instilled in you like really young age, like you should give back and help others?
Yeah, I think that instillment from my parents to, really put yourself out there and help those people who are in need. They just instill that in me. And then going into college, I volunteered in many different aspects, like you name it, like at the community hospital, the homeless shelter, being a part of nonprofit clubs all throughout high school and college. So I had a long standing history of having that passion to give back to the community.
Yeah, that's really cool. Were you doing anything medical related when you were younger in high school, or was it closer to college that you kind of found your groove and your interest towards medicine?
Yeah, in high school, let's see, I just remember volunteering at the homeless shelter and preparing food at the food banks on weekends. And I think that was like the closest thing as far as being exposed to medicine. Other than that, I was in like in track club or key club, and not really medical yet, but I
Uh-huh.
knew I wanted to be a doctor at the time.
Oh, okay. And
Yeah.
so did you have any like close family members or anyone that was involved in medicine that you kind of looked up to, or it was like focused on my path, and then later on you kind of realized medicine was your true passion?
Yeah, I didn't really have much family members in medicine. I had cousins in Burma who were practitioners, but here I think it was like my doctor at Kaiser that I went to, and I just saw like how amazing of a job they had and like the kindness they like presented towards me. I think that's really what instilled that like inspiration for me to be in healthcare.
And in terms of like your culture and upbringing with your parents being from Burma, did they
Yeah.
kind of like a lot of people I talk to, they say, oh, my parents are pushing me towards one certain career
Yeah.
because they want me to do well. And in their eyes, being successful means I'm going into this specific career. Was there anything like that from your parents, or were they pretty open to you getting involved in anything you're interested in?
Yeah, I mean, my parents, they're definitely very strict. I have like a tiger mom and I think a tiger dad. My mom, she's open to whatever career that I wanted. And my dad, he knew the type of personality I had. So he definitely pushed me towards becoming a doctor at the time. But now they, I think they're more open for me to be in whatever field I want as long as I enjoy it. But yes, at the time, they definitely pushed for me to become a doctor.
One thing that people might not know about you is you've done a lot of print work and modeling, and
Yeah.
that's really something cool and unique to yourself.
Mhm.
Was that something you started out early on, or was that something also that was more like a recent involvement with social media?
It's very interesting. I started modeling at the age of 17, right when I was a freshman in college. And I started off by doing like print work and just like trade work. And I modeled at my first automotive show in 2011. And from there on, I was able to do over 250 trade shows all around California. And then I landed a lot of print work in magazines. And it was such a great experience, not because of like the exposure, but more so because I was able to connect with people of all ages. So like a lot of the people at the shows, they're from like any age, from young to old, and I was able to really relate to them. And knowing that I wanted to be in medicine, I kind of used that as a practice. Like, okay, like I can talk to this person of any age, so when I see my patients, I know that I'm able to connect with them. And I think that was the best part about modeling, was that I get to, have that in the back of my mind.
Yeah, no, there's so many unique experiences and things that you could really take from that. Like you said, interacting, being able to interact with anyone. Same deal with working in medicine. You have to be ready to build a rapport and take care of, interact with any type of person that walks through the door. So really good skills to learn early on. How about in like your time for college? Were you really studious, or were you more like the social butterfly? What were some of the things that
Yeah.
life was like for college?
It's very interesting. I think, growing up, in a really strict family, I think when I first got out of the house and I went to college, I was a social butterfly. I pledged for sorority, but de-pledged right before Hell Week. And then after that, I had my fun for the first year, but after that, I was definitely a little bit of an entrepreneur. Like, I would study from Monday through Friday, and on the weekends, I would go work shows. So it would be like my other job.
Did you find it difficult at that time? Were you pretty like busy, where you really had to manage your time effectively? And how did
Yeah.
you go about making sure you could fit so many things on your plate during that time?
Yeah, I think I really like the challenge of finding balance between school and extracurricular activities. I was also in a lot of like health clubs like AMSA, partaking in like student like officer positions, fulfilling that need for a challenge. I think I was able to balance it all. It's all about balance. Like, you just knowing yourself, and if you're able to do that, because I didn't feel overwhelmed. I found it really fun and thrilling.
Oh yeah, I'm sure. Yeah, there's definitely an aspect there you're gonna enjoy and have some fun with it. So that was neat. Were you doing
Mhm.
any other things like job-wise, medical related, or were you taking anatomy and physiology? Were there some things kind of early in your college career that helped you get towards the medical route?
Yeah, so I was a manager at an acupuncture clinic for a long time. And then I also shadowed a lot of physicians in all different areas. So, yeah, that was like my main job, but also I was an intern at the community hospital for a few years as well. Yeah.
So many people, I feel it's so important for people to shadow, no matter what career path you're going in medicine, just shadow as many different people, different career paths as possible. I know you mentioned
Yeah.
you shadowed people in different areas. What kind of insight did you gain from shadowing various types of people and careers?
I learned so much. I think shadowing different careers in different communities is very important too. When I lived in Riverside, I shadowed physicians in the underserved community, and also here in Orange County, where we're a little bit more privileged. So I think it's important to really gain honest insight from these individuals and be exposed to like how healthcare is different from one community versus another.
Oh yeah, definitely. It's that's really neat that you had that experience. Riverside. There's different demographics, and that's really great to be exposed to that variety early
Mhm.
on. So you're getting like closer towards graduating college, and what was kind of going through your mind then? Were you like, hey, I want to go full on into the modeling, or was it more like, oh, I need to go towards medicine because my parents want me really to be in that career path? What were some of the things
Yeah.
towards the end of college?
Yeah, I remember, besides having senioritis, I recall My parents, definitely that pressure, like, of course, being Asian, like some of us have really strict parents. So they're like, after college, we expect you to go straight into graduate school. But, I did think about applying to medical school, but I wasn't 100% sure at the time. So I wanted a little bit more time. So I knew that I wanted to continue modeling, but not so much the events. So luckily, Instagram started growing and they kind of brought this new community of influencers. And I've been really fortunate to be able to be a part of that since then.
That is really neat. It's funny how social media has kind of taken people down certain pathways. Like myself, I would have never expected being able to be involved in so many unique opportunities or just really
Yeah.
connect with so many amazing people as a result of social media. It's just really
Yeah.
cool to get involved and really connect and help people and pay it forward. And I see you doing that all the time. So kudos to you for that.
Thank you. And also you. I mean, you do so much too.
And then, so when you graduated from college, uh, what did you get into? Something right away, or you knew you had to take a
Yeah.
couple gap years?
Yeah, so I knew that I wanted to go to Orange County. I always had the dream to go to Irvine. So I moved to Orange County. I started working as a medical scribe at Hoag for many different surgeons for a couple years. And I really wanted that time to figure out, okay, do I really want to go to medical school? So I'm going to shadow more physicians. I already shadowed at the time internal medicine physicians who were entrepreneurs also. Um, so that was like my last, bit of experience before I applied.
Did you get to the point where you actually like took the MCATs, or did you decide prior to that that you're gonna go a different route?
Oh man, yeah, I definitely took the MCAT and poof, I remember during my break, I totally took a little 30-minute nap. I was so tired. That was not great. I don't recommend that to anyone, but that was me. I was studying so much and then, yeah, it's a long test.
Definitely arduous test and difficult to get through. A lot of people studying like crazy beforehand, and it's really a test
Yeah,
that you don't want to have to endure more than once. And what was kind of the next step? So you took the MCATs, you're kind of working, doing scribing. Was there
yeah.
anything else that you're kind of getting involved in that helped you make a decision one way or another in terms of a career path?
Yeah, actually after working at Hoag for a couple years and shadowing numerous surgeons, I thought, okay, I don't want to be in surgery, but I might want to be in internal medicine. So I gave it one last chance. And at that point, I was like, okay, you know what? I don't know. I'm leaning towards PA now. This profession is like the top 5 professions in the United States. It's growing, at a fast rate. So I took a job as an internal medicine scribe at Hoag. And then I figured out that I wanted to become a PA at the time because I really wanted balance of life, like being able to balance family and work, and PA really allowed that. And there's so much more autonomy nowadays with PA. So I was like, okay, this is perfect for me. So that's when I decided to try the PA route.
Nice.
Yeah.
Yeah, so you're kind of scooting towards the PA route, and I know you did a lot to really get yourself involved into shadow PAs and learn
Yeah.
more about the profession, and you're working
Yeah.
towards that. Was that something you're working towards for how long again? Was it like a year or two before you decided to go
Yeah.
a different route?
Yeah, I think about like a year and a half. While I was working, I was preparing my application for preschool. So I started taking more classes at like local colleges to fulfill the prerequisites. And then I applied to PA school.
And a lot of people think about, okay, I'm going a certain route, and then they pivot and switch to a different career, and that's totally fine and great.
Yeah.
But can you explain to some people that might be in a similar situation where they're going one route and kind of switching to another, in terms of like, how did you get into that mindset of I'm okay and this is now my new pathway? Was there some specific
Yeah.
event, or was it more just like talking and realizing, hey, this career path kind of fit my personality better?
Yeah, I think that's such an important question to like anyone struggling with that. I think, first off, like to realize the situation. And like for me, I was definitely like depressed for a few months when I knew that, okay, I thought this was my lifelong dream and transitioning into PA is going to be something different. I think just realizing and admitting to yourself like your real feelings. And then after that, figure out what's the next steps and know that if this is really what you choose, that and you're 100% sure that you should try it. I mean, the worst that could happen is that it's not going to go well for you, but at least you're going to try it and go with your heart.
No, that's excellent. And it's so important for people to realize if something doesn't go your way, it's, you can't internalize it and just let it like consume you. You need
Yeah.
to be able to like persevere and work through it, get yourself back up and just
Yes.
move on to the next step or move on to the next thing. So it's really great advice on that. So you applied to PA school and what kind of happened next?
Yeah, so I applied to PA school last year. I was 25, and I applied to about like 12 schools, and I was really hoping to get in. I was really excited, but unfortunately, I didn't get in, and I think it could have been maybe my GPA wasn't as high. So, and I knew that if I waited another cycle, I could do that. But I knew that what I wanted to go into was aesthetic medicine. So I was like, okay, I'm going to consider more options. Like, let me lay out all the options. And I figured out, okay, like, I think a nurse practitioner route would be a great route. So I was like, okay, I'm going to apply for nursing school. And then that's how I got it.
And so now you're currently in nursing school, right?
Yes.
Awesome. And then for people that are interested in the nursing career path, can you just give some insight on what life is like as a student?
Yeah, so currently I'm doing an accelerator nursing program. So it's like for me, since I already finished all the prereqs, it's just 2 years. For my school, they require you to take 2 terms of just courses to get you prepared for core. So pathophysio, critical reasoning, courses like that. And then after 2 terms, you start your clinicals, your rotations, and then also your core classes. So starting August, I will be in my clinicals and just 2 years, and then I'm done. Yeah, with nursing. Yeah.
Nice.
Yeah.
And then now that's really cool that you have your interest. You kind of already know what specialty you want to get into, and that's really neat. Can you, there's potentially a lot of people out there that are very interested in getting into aesthetics as well. Can you give any advice for people that might be interested in ways about like how did you network or connect with people to kind of help guide you in that direction?
Yeah, I think first off, you definitely have to get your hands, in the field. I worked as a medical assistant for a little bit in dermatology at an aesthetics clinic. So it's important to be able to shadow the practitioner or whatever field of medicine you want to get into. So you know that this is really what you're passionate about and you're interested in. So aesthetic medicine is definitely like the field that I believe I'm gonna end up in.
That's one of the really neat things about the medical career, especially like PA, nurse practitioner, is that there's a lot of options out there. You can work in one particular field and then switch to something different, and you might get into aesthetics and realize you're more interested in something else down the road, and you'd be able to do that. And it's just really building off of your skills from your prior experiences. Something I want to bring to everyone's attention that's watching is you've had such a unique and different background. You kind of went through almost every route.
Yes,
and the fact that of course you get up and you continue on and you persevere is awesome, but a lot of people don't realize it, and you need to really visualize this as well, is all those were past experiences that help build you up so that when it comes time, you're going to be more prepared. You're going to be able to be involved to handle certain situations, interact with different types of patients. So it's really something that's going to help you in the long run to become a great clinician.
Yeah, I think, life throws lemons at you, and you kind of just have to like take it and think about like, what are you going to do next? And you can't give up. There was many times where I did want to give up. I like considered business because I knew I was very business savvy. But like, you really have to dig deep and like intrinsically like analyze yourself to think about what do you really want to do. And I definitely had many talks like that to get to where I am today.
No, excellent. And I know there's a lot of people out there watching that can relate to you in some fashion. And so it's really great that you provided that advice. I want to kind of touch base on your entrepreneurial aspects because you've done really well in terms of kind of building a brand and starting new endeavors. And was that something that was kind of instilled at you in a young age? You're always like wanting to create and be involved in different things, or?
Yeah, I start to think, okay, like, why do I love making deals and being so business savvy and being creative and having this passion for that too? And I was like, okay, well, you know what? I think it's my mom because she's a businesswoman and I see how hard she hustles late at night. And I think I kind of took that trait and applied it towards my life about working hard towards what I believe in. So just starting the different brands was very important to me because I'm able to give back and be creative in that aspect.
Really exciting things that you're going. I want to touch base and get more into MedCon. For those
Yeah.
of you that don't know about MedCon, maybe you could just briefly summarize what MedCon is and how
Mhm.
you and Audrey created it and
Yeah.
share it with everyone watching.
Yeah, so I remember me and Audrey, we met a couple years ago. She's an internal medicine doctor at Loma Linda. She's an amazing person. You guys might know her as Dr. X Audrey Sue on Instagram. We just wanted to meet up and have dinner in Riverside, and we talked about like, okay, this growing community of healthcare influencers, and how cool would it be to see everyone gather together, all these influencers from all over Southern California, and to meet each other. And then, so we first started our first SoCal meetup in Irvine, and I still remember that day. It was like so amazing. Everyone's so positive. It's such a positive force in medicine, and I was like talking to Audrey about it, and we're like, okay, how about if we can expand this? Like, this could help more people. Like, there's so many people who are struggling in medicine as in terms of finding a balance between health and wellness and motherhood and all that. So we wanted to present different influencers who are professional healthcare providers from all over to be able to give honest advice to pre-health students who want to learn about how it really is to be in medicine.
So last year you had your first annual event. I know there was a lot of time
Mhm.
and hard work and effort and a great team community to put it together. And I was
Yeah.
thankful to be one of the speakers on the PA panel, and it was just a really
Mhm.
wonderful event. Can you tell people a little bit about the day's event and some of the things you're looking forward towards in future events?
The first MedCon, we have a lot of vendors and a lot of amazing speakers. So we're gonna change the venue to a more modern atmosphere, and we're gonna have even more brands. I mean, yes, scrubs, but more wellness too. That's based off of medicine. Since there's a lot of new brands that are mixed with wellness now, so just really expanding it um, and having a lot of good food there too is very important.
Yeah, definitely.
Yeah,
Healthy food at that. Yeah, you had a lot
healthy
of great
food.
healthy food vendors and things like that. So that was really cool.
Yes. So I'm going to present more options. So it's going to be a way bigger venue. We're planning for 2021.
And I want to kind of transition a little bit towards, I know there's people out there that are involved in social media and they might
Yeah.
have some questions on how can they like evolve or improve their brand awareness or just some things in terms of social media. I
Yeah.
know you use social media as your creative outlet, but for
Yeah.
someone that's kind of brand new, that's
Yeah.
in the medical field and also starting to post more on Instagram or be more into that aspect of it, what are some like beginning tips that you recommend people look into?
Yeah. I think the hardest part is really just starting. Having that fear that you may not, have the most followers, but just to try it. Take some photos with your cell phone or have like your family or your friend take some photos and then have a list of topics that you want to discuss about your page. I learned that when you first create a new page, you should have like 100 topics that you can talk about in different fields, and then think about which field is the most easiest for you to make topics on, and that's where you should kind of base your niche on for social media.
Neat, that's great advice. Have you come across or found it difficult kind of blending the medical aspect of things and then your personal life on Instagram? I know some people feel like, hey, I want to just keep the two things separate and maybe have just
Yeah.
my independent, like medical related stuff that's more professional, and then another one that's more
Mhm.
personal.
I really think that it's okay to blend a little bit of your personal life into your feed because people really want to be able to relate and know who's this person behind the Instagram. Like, even if you have like a healthcare office or like dentists, aesthetic de- dentists, they have their pages of all dentist stuff, but some of them have it where they include their family and talk a little bit about it. And I think that gives it a real personal touch. And I do highly recommend that.
Yeah, it is always neat scrolling through and seeing some of the things that might be more related on their personal life. Maybe they enjoy going to the beach or travel, and some of those
Yeah.
things are really cool because you feel like you get to connect with them on a more personal level
Yeah.
when you learn some of the things like, hey, they're a normal person just like me.
Yeah,
They
totally. Because
enjoy
we're all on Instagram to just really connect with each other and see the struggles that we all have. I mean, social media can sometimes feel like it's just like a highlight reel, which is true, but you want to be able to share like your failures too and be really transparent with your followers so they can connect with you on a higher level.
Well, you have such an amazing story, and I thank you so much for joining me today. But I like to finish off each interview with a segment called Drop Some Knowledge. I want to ask you, for anyone out there that's just kind of getting into medicine, or maybe they're in a similar situation where they're going down one route and they decided to kind of quickly pivot towards another, what's kind of your top piece of advice that you'd recommend for someone interested in pursuing the medical field?
Shadow a lot of like providers and really know exactly what they do, not only in their 9 to 5 job or their work hours, but to know like how it is like that, like in other aspects of their life, like could they balance lifestyle, like balance family and everything else, like is that something that you place on a higher level than work? You have to really like intrinsically like think about like what works for you, because sometimes people just go with the flow and then they realize they're at this stop and they don't really want to do it. So to save yourself a couple years, just to be really honest with yourself and think about what do you really want.
There you go. Excellent advice. You definitely want to kind of internalize it, do a little
Yeah.
self-assessment, figure out what your goals are, and then find the career path that aligns best with that. So that's a wonderful insight. Thank you so much.
Yes.
Thank you so much for your time today. I really appreciate it. I know our followers and viewers are really going to appreciate hearing your story. Where can people connect with you or reach out to you in the future?
Yeah, so you guys can follow me on Instagram. My at is the Sandra Wong, and also I just started TikTok, so I'm creating some awesome content there. So if you guys want, come check my page out.
Well, thank you so much.
Yeah, of course. Thank you for having me.
Well, there you go. What a great interview with Sandra. I'm so thankful for her being able to open up and share her backstory. She has so many unique things going on. I feel really fortunate that she was willing to share it with all of you today. If you found this interview motivational, helpful, insightful, make sure you subscribe to my YouTube page. Each week, I'll post a new interview with someone with a unique and exciting backstory. Do you have a person you'd like me to interview? Leave their name in the comments below. And remember, we all have a unique journey to medicine.